Next, we're going to hear from our Public Health Commissioner, Eric Faisst.
Good afternoon, everyone. Thank you for allowing me to be part of this. As you are already well aware, Madison County, like every other county in New York State, is experiencing a rise in COVID cases. This increase was to be expected, and as more people move indoors for the weather and with the holidays that bring family and friends together. As of this afternoon, we have 373 active cases. On this same date last year, we had 413 cases. We peaked at about 421 cases on January 8th. So I expect that we will continue to see cases rises into the beginning of the new year. As with last year, this level of active cases puts a strain on the health department's capacity to respond and to engage in public health activities that are necessary to protect the health and well-being of our residents. As the Public Health Director, I believe strongly that vaccinations represent our best defense against COVID and its variants. Wearing a mask, social distancing, washing your hands, staying home when sick, avoiding large gatherings, all provide additional layers of protection and will still remain important practices that everyone can carry out. I and my department will continue to strongly encourage that everyone get vaccinated if they are medically able, and to practice these simple things so that you can lower your risk for infection. In regards to the state mandate and the subsequent resolutions the board has before them, allow me to provide you some additional information for you to consider. Last Friday, December 10th, the governor announced that effective this Monday, this 13th, masks will be required to be worn in all indoor public places unless businesses or venues implement a vaccine requirement. As you may recall, last year on April 12th, 2020, then Governor Cuomo mandated face coverings for public and private employees interacting with the public. The current mandate obviously is somewhat different because of the vaccine requirement. We didn't have vaccines last year when that mandate went into effect. You may also remember that Madison County did carry out enforcement activities in response to the 2020 mandate. However, the situation in which these mandates were issued are dramatically different. And it's in these differences that create our current challenges. First, in April 2020, the mandate applied to only essential businesses. All other types of businesses and venues were closed at that time. The malls, sporting events, large gatherings, and other non-essential businesses. The 2021 mandate applies to, and I quote, any indoor space that is not a private residence, end quote. Now, aside from the fact that I'm not exactly sure what type of businesses and venues that applies to, it clearly applies to considerably more entities than the previous mandate. In April 2020, when the first mandate was issued, Madison County hit 31 active cases. The new mandate was issued when our caseload was 12 times higher. In 2020, my department had a list of over 100 volunteers that we could draw from to assist our staff in contact tracing and other activities, or help free up my staff to carry out these activities. Our current list of volunteers is under 10. The reduction in volunteers is mainly due to the fact that many of them returned to their own jobs once their places of employment reopened. A considerable amount of staff time is involved with contact tracing, case investigations, and the follow-up activities such as issuing release orders. We've hired additional staff to help, as well as utilize the state's contact tracing employees to their maximum availability. We also pull staff from other departments and staff from divisions within the department, such as our environmental health staff, to help with these isolation and quarantine activities. I mentioned the environmental health staff specifically because they were the staff we used to enforce the 2020 mandate. Even with resources we have, as of yesterday, we were over 150 cases behind in our contact tracing and case investigation activities. We do have a couple of county employees, some medical reserve corps volunteers, and community volunteers that help. And I am extremely grateful for them and the work that they do. And I want to give them a quick shout out for their help. In April 2020, there was no vaccination clinics. There was no vaccine. The testing activities were coordinated through a partnership with Upstate Medical and Essentia Home Care Agency, whose staff came on site at various locations in Madison County to provide the testing. In 2021, my department staff is conducting testing twice a week. The same staff, when not testing, or contact tracing are also conducting vaccination clinics on a weekly basis. Now, other non-clinical department staff and volunteers assist with both our testing and vaccination efforts. In 2020, the state established a system that would allow individuals to anonymously submit complaints about businesses that were non-compliant with the mask mandate. That system does not exist at current. Also in 2020, the New York State Liquor Authority agents conducted enforcement activities in parallel to what counties were doing. I'm not aware of any state agency that will be involved with the enforcement of the current mandate. Similar to the 2020 mandate, the current mandate and its limited guidance materials put out by the state do not clarify or define what enforcement is or how it should be carried out. Without clear guidance from the state, counties are left to develop their own approach to enforce or not, similar to what happened in 2020. This resulted in considerable confusion and frustration felt by our residents and businesses. In our normal regulatory activities, the state prescribes what enforcement entails. For example, restaurant inspections are conducted through in-person, unannounced visits at least twice a year, depending on their associated risks, and then we have a set of specific things we look for during the inspection. Post-inspection, there are enforcement activities such as issuing citations, collecting fines, and even administrative hearing process, should a business challenge the citation. If an administrative hearing process is requested, the county has to arrange for the hearing, which includes getting a hearing officer to hear the case. The hearing process takes several weeks to arrange and to carry out. Part of what the administrative hearing process looks at is whether or not the county followed the proper protocols and procedures for properly inspecting and issuing the citation. Without clear guidance from the state regarding these processes and protocols, this could affect the outcome of any hearing that we have. Another aspect of enforcement pertains to our authority over the businesses or venue. For those in which we have regulatory authority, such as restaurants, should they fail to pay a fine or correct the problem, we have the ability to pull their operating permits and close them. For the majority of the entities under this new mandate, we do not have that option. They could ignore the fine without any recourse. Additionally, when a citation is challenged, it requires involvement of the county attorney's office and her staff and their resources, in addition to the county health department staff. In 2020, we implemented a 3-step enforcement process that involved outreach and education, initial warnings, subsequent visit and inspection, and if the violation was observed during the inspection, it could result in a fine. Given the different environment in which the new mandate finds itself, enforcement per se would be extremely difficult. This does not mean that we don't do anything. My office is and continues and will be sending out materials to the affected businesses and venues, one, to educate them on the mandate and help them interpret this implementation. We are providing them with materials such as posters and signage that they can put up in their places of employment. And we stand ready to assist them in any way that we can to facilitate their efforts to comply. Interestingly enough, in an email from the state to the local health departments that we received this past Monday, the state, I believe, has seemingly grasped or appears to have grasped the enormity of what their mandate requires. Within the email, the state notes the following: "We do expect this protocol," and I quote, "we do expect this protocol to be largely self-enforcing. It is our expectation that New Yorkers will understand the importance of following this requirement as we continue through the holiday season, where the surge in cases is expected to persist." Also within that quote, "Local health departments can enforce these requirements if they choose to pursue enforcement." I strongly concur with the statement that self-enforcement is a large aspect of this mandate and must be. Outreach and education was also stressed by the state as being key to the effectiveness of this mandate. For almost 2 years now, since this pandemic started, health department staff have worked 7 days a week and most holidays, and we will continue to do so. Aside from the exhaustion that comes with the ongoing daily work, my staff is subject to daily verbal abuse and harassment from residents, from businesses, and from people that don't even live or are from Madison County. Over the past several months, this abuse has gotten harsher and more frequent. This abuse is mentally draining, even more so because it's coming from the people the very people that we're trying to protect and keep well. I am concerned for the health and well-being of my staff, and I'm especially concerned for their health and safety should we be required to send them out to inspect and enforce this mandate. Please excuse my bluntness, but I will not put my staff's health and safety in harm's way. I strongly believe that vaccinations and masking are effective, and the science supports that. I will continue to encourage our residents and businesses to adhere to and support these requirements and practices and make every effort to facilitate their use. Since the beginning of this year, our emphasis has been on getting people vaccinated, and it continues to be the focus. Registration for our vaccination clinics and testing events continue to fill up, and we continue our efforts to make vaccine available to any resident who wants one. And we will, and we have, and will continue to put out our messages to our residents about the 3 W's. Wear a mask, wash your hands, and watch your distancing. Thank you.